So welcome to tinnitus, guys. So tinnitus is a ringing noise in the ear. Okay, mostly that is unilateral or bilateral ringing sensation in the ear. It is characterized by the sound within the patient, present as rusty, roaring, or hissing type of sounds. What are the type of sound? Rusty, roaring, or hissing type of sounds. Tinnitus is a ringing sensation in the ear. It can be unilateral or bilateral, or it can be present within the patient. Okay, rusty, roaring, and hissing type of sounds. Types are objective and subjective. Objective, only person can be heard. Subjective, patient as well as examiner can be heard using the stethoscope. Okay, causes. Objective causes are first take vascular system. Okay, vascular causes, arterial causes, venous causes. Okay, vascular causes are AV shunt, arteriovenous shunt, AV malformation, and glomus tumor of the middle of the ear. So we'll make a soon on glomus tumor also. Next is arterial causes. Arterial causes are carotid stenosis and carotid aneurysm. Venous causes are venous hum, dehiscent jugular bulb. Other causes are palatal myoclonus, tensor tympani myoclonus, benign intracranial hypertension, clicking of temporomandibular joint, and dental causes. Okay. Tinnitus is a ringing sensation in the ear. It can be objective and subjective. Objective causes are vascular system, whole arterial, venous, and vascular system are involved. Palatal myoclonus, tensor tympani myoclonus, clicking of temporomandibular joint, and dental. Okay. And subjective causes are, you can be remember it by MNOPQS. Okay, Q for cardiovascular, S for psychological, M for metabolic. Okay, for metabolic, whole metabolic system you take, like what all will come: hypothyroidism, hyperthyroidism, and hyperlipidemia. Neurologic means brain injury, temporal bone fracture, brain hemorrhage. Otologic means ear, impacted wax, foreign body, CSOM, ASOM, and Meniere's disease. Chronic suppurative otitis media, acute suppurative otitis media, and Meniere's disease. Okay, Meniere's disease, endolymphatic hydrops. Pharmacological causes, that is ototoxic drugs, that is neomycin, gentamicin, amikacin, etc. Certain drug used by the patient. Okay. Q for cardiovascular, that is hypertension and anemia. Psychological, that is PSI, psychological anxiety and depression. Okay. Let's revise. Tinnitus is the ringing sensation in the ear. It can be unilateral or bilateral. The sounds are rusty, roaring, or hissing type of sound. It can be objective or subjective. Objective means only person can hear. Subjective means both person and the examiner can hear with the help of a stethoscope. Objective causes are whole vascular system is involved, and palatal myoclonus, tensor tympani myoclonus, clicking of temporomandibular joint, and dental causes. Okay. And subjective causes are MNOPQS, metabolic, neurological, otological, pharmacological, cardiovascular, and psychological. Okay. You can remember by this mnemonic. Write some examples for that. So now coming to how you will manage the tinnitus. It can be done by reassurance and psychotherapy. Many times the patient has to learn to live with the tinnitus. Okay. Remember, tinnitus is a symptom but not a disease. Okay. The patient had to live with the symptom. Techniques of relaxation and biofeedback. Sedation and tranquilizers, they may needed in initial stages till the patient has adjusted to a symptom. And masking of tinnitus. Okay, and masking of tinnitus means a person will be having a ringing sensation in the ear. Okay, and this ringing sensation can be masked with the help of other different kinds of sounds. Okay, like clicking clock and fan, etc., which masks the tinnitus sound in the ear. Okay, the patient focus should go towards other sounds rather than this tinnitus. Okay, another is tinnitus instrumentation. It is a combination of both hearing aid and masker. Okay, another is tinnitus retaining therapy. Tinnitus retaining therapy means it consists of two: habituation of the reaction and habituation of the tinnitus. Okay, along with that, the therapy consists of two things. One is a counseling, COUNSC, counseling, double L, and another is sound therapy. Okay. Counseling means you have to educate the patient that the tinnitus is caused by these some symptoms are there, and he should limbic system, autonomic system, and primary sources of negative reaction of the tinnitus, sleep disturbances, anxiety, depression, annoyance, etc., should be counseled to the patient. Okay. Other is a sound therapy. Sound therapy means the patient is exposed to environmental sounds, music, radio, television, or use of hearing aids. Okay, in general, he should avoid the silent environment, because if he lives in a silent environment, he will hear the tinnitus sound and he will get annoyed. Okay, if he hears some external sound, his focus goes towards that. Okay, tinnitus is not only because of a ringing sensation in the ear, but also there is some combination things. The patient get annoyed because of his limbic system, auditory system, and autonomic nervous system. That's it, guys. This is the end of the tinnitus. Okay. So Jai Hind, Jai Bharat. See you in the next video. Please check out the playlist, ENT playlist. Okay, and watch all of our videos. Bye bye.